Greetings once again. It's a pleasure to be here with you. And today I'm going to talk about adopting a culture of continuous improvement in community pharmacy practice. And the reason as to why I feel this is a very critical topic for us to discuss is the fact that most of care delivery and access to healthcare services is being driven by community pharmacies who are working in communities closer to the patient than most of our healthcare facilities. And therefore, it makes it a critical area where, as pharmacists, as practicing professionals within the community pharmacy setting, we can deliver quality healthcare services to the patients who need them. But as we do that, we also have to look at it in terms of how are we advancing the profession of pharmacy, that is on one end, and the other end is how are we improving access to the quality of care and even in the health outcomes of the patients that we are serving in these particular communities. So when we look at it from that perspective, I think as pharmacists, if we are practicing within the community pharmacy practice, pharmacists, pharmaceutical technicians, pharmaceutical technologists, whatever it is, the profession that you have your background on training, you need to adopt a culture of continuous improvement and looking at it in the sense that we're never going to be static. There's always change, and change being the only constant we are assured of in this life. Then we need to have that change and embrace it from a point of we are making better what we have been used to, and we're making it improve every single other day, because at the end of the day, that is what will make us be different from every other person within the space. And other than that, it's the only thing that will be our unique selling proposition, the unique identifier. What will make me want to come to your pharmacy or pharmacy A instead of pharmacy B? What will make me want to go to Odhiambo's pharmacy and not another person's pharmacy? It's because of quality of care that I'm assured of getting at that level, and how the supportive ecosystem is to enable Odhiambo's pharmacy to deliver the quality of care that we deserve and that we desire to achieve out of all those services that we seek from them, and that will enable us achieve the positive health outcomes that we desire. So continuous improvement is a critical piece of what we need to advocate for, we need to emulate, and we need to advance towards, so that at the end of the day, we are not only doing what needs to be used to be done 1,000 years ago, 100 years ago, 10 years ago, or even a year ago. We need to be looking at what does the future look like? How do we embrace that future? And in embracing that future, what are the driving factors and what are the key determinants to enable us be strategically positioned to thrive rather than survive in that future that we envision? So in this case, then, one of the key things that I want to look at is what are the key services that are being delivered at community pharmacies? And I would look at them in two pillars, and then I'll look at the continuous improvement aspects in the two of them again. So the first one that I'm going to look into is quality pharmaceutical products and healthcare technologies. Pharmacies serve as outlets where people access health products. You're sick, you get a prescription from a healthcare practitioner, let's say a clinician or a medical doctor, you'll want to fill it from a pharmacy. And therefore, the quality of medicines that the pharmacist or the pharmacy technician will offer you will determine whether you realize the benefit that had been foreseen by the doctor who prescribed that particular drug for you. And if the drug is not of the right quality, you are at risk of suffering either adverse events or side effects, or even not getting healed. And if you're not healed, it means if it was a serious condition, it will continue getting complicated and all, and that would even lead to loss of life or even morbidity and any disabilities that might arise from such kind of a situation. So the key bit is we need to ensure there's access to quality healthcare products and technologies, that is medicines, the diagnostic materials and all that. For example, let's say we have a patient who is hypertensive. They need to monitor their blood pressure every other day. If they come to your pharmacy and they buy a blood pressure monitoring machine, then you need to be able to ensure that the machine that you're giving them is a quality one that will give them the accurate readings. It will last them a long period of time, not the one that they'll buy today and it will be destroyed the following day. So how do you ensure that happens? It's a critical bit that you need to look into as a pharmacist. The medicines that people are coming for example, one of the critical drivers that we are now, challenges that we are facing as healthcare practitioners is the burden of antimicrobial stewardship. And when we look at it from that perspective, one of the contributing factors has been irrational use or misuse of antibiotics. So if a patient comes to you and probably you've given them substandard antibiotics because you didn't follow the quality measures in terms of the good distribution practices, you have somebody selling you medicine from antibiotics that might be cheap. They're cheap, yes, but they're compromising on quality. They do not meet the required strength for the particular patient, and therefore they're not able to get treated from these medicines and they're going to be affected. So you have to ensure that you have the right quality of your medicines and healthcare products, and even the medical diagnostic devices, the test kits, the non-pharmaceuticals. that are being sold at your pharmacy. So once you ensure that those are in quality, then you need to look at, are you complying to the best prescribing and dispensing practices? And when you look at these, we're looking at who should prescribe, who should handle. Are you documenting when you dispense any medicines? So that, let's say, for example, if Odhiambo comes to your pharmacy today and I buy an amoxicillin or a paracetamol, for that matter, if some other person comes to follow through that trail, they can know where that medicine went. If it was a fake drug, when you're talking about the quality, we can trace and see this is the past patient bought this medicine, this number of quantities. And when, for example, when we're looking at recall processes, we can know who has that medicine, assuming it was one of the things that are causing very serious damages and could harm the patient in that case. So you have to have that quality framework that you're assuring. There's a compliance mechanism in place and you're able to trace your medicines. And if not able to trace, at least you do the best you can at the point of dispensing to ensure the right patient gets the right medicine that they need and that they deserve. That is a critical bit that you have to ensure. So prescribing, who prescribed that medicine, who do they have the legal provisions to prescribe it? Once that is done, move to the next phase. Are you dispensing it? Who is dispensing? What are the dispensing measures that are required? Are you documenting? Are you noting on the prescription, the dispensing pad on your end as a pharmacist or a pharmaceutical technician? When you give it out to the patient, the labels that are being given to the patient, are they written the right way? If you've done it the right way, then it means the patient can use it the right way and they can achieve the outcomes that is getting back to good health as we wish for. And that is our key figure. So that is number one, looking at the health products. Because there's no pharmaceutical practice when we don't look community pharmacy practice without the medicine, because that is what is going to alleviate the symptoms and also going to manage their conditions. So the medicine that are being dispensed, the medicine that are being issued to patients, they have to be the right quality. That's number one. They have to be affordable to them. You need to look at exploring the market to assess which are the sourcing mechanism, which are the supply chain models and supply chain pathways that I can explore to ensure I get affordable, but at the same time get quality medicines that will serve the patients that I'm serving, the patients that I'm dealing with in the community where I operate. And oftentimes we operate in communities that we know what works for our patients. We know their financial positions. And if I'm going to sell a medicine that a patient can't afford, obviously they won't buy it, and I'll be having expired medicines. Expired medicines are not good for anyone, whether you're a pharmacist, they're not good for you. They're holding your money and leading to expiries that will be losses. And you'll have to spend money to destroy them. So you have to ensure that you're stocking medicines that are within the pocket level, the economic status of the community you're serving. They're able to derive value from them, they're of the right quality, and you're doing the best practices in terms of prescribing and dispensing them, and even documenting that. I mentioned in one of the series, the videos that I had recorded earlier on documentation. And I think that is one thing that we have to acknowledge, that for us to improve in our practice, we have to document what we're doing, and we have to have a trail of what has been done, how it has been done. And that gives us a way to audit in the future on what went wrong and even find ways of improvement on the same. So that is one bit. The second bit, as we acknowledge that community pharmacy practice is evolving, we have to acknowledge that there's a need for additional services. And the need for additional services is because initially the seeking of clinical counsel and all those services were being directed majorly to the hospitals. At the current moment, patients generally are more predisposed to come to the pharmacy to seek counsel and even to buy medicines than to go to a hospital where they'll get a prescription to come buy the medicines. They have to save on time. They have conflicted and competing priorities in their pursuits in terms of the available time, and therefore they find the most optimal way for them to achieve these. It's on convenience and efficiency. And when we look at convenience and efficiency, then your key role as a pharmacist is to integrate these pharmaceutical services. What are the health conditions that are affecting your community? Assuming you're in a community where most of them are suffering from non-communicable diseases, diabetes and hypertension, cancers and all that. Are you supporting them in the life course management of these conditions, from preventive measure promotion, curative, rehabilitative, and even the supportive care? That is the care that they need to just go through their life, even using their medicines, their support system. Are you offering that? If you're able to offer those additional services, you are in a better position to serve them and also to ensure they build trust in you and the quality of care that you offer them. You need to look at it in terms of integrating pharmaceutical services. Medication therapy monitoring. When you give patients medicines, you need to look at it in terms of What is the efficacy levels? Medication therapy monitoring would be looking at one, you can start from medicines reconciliation. Which medicines have been prescribed for them? Is it ideal for their condition? If it's not ideal, what are the probable areas that you need to intervene? Let us say they've been given 3-4 medicines. 3-4 medication, do they have drug-drug interactions? What do they use as their staple food in their communities? So some of them, the foods and even the other herbal products that they might be using have interaction with these medicines. Can you reconcile those and ensure contraindications, interactions, anything is eliminated so that patients will be using medicines that are safe for them, that are going to give them the results that they desire? That is the first phase that you need to ensure that is done. The next phase would be when you're looking at engaging with hospitals or even laboratories around you, you need to be looking at what are the therapeutic levels of the drug. For example, if patients have different metabolic rates, they can break down their medicines at different intervals and different speeds, and therefore, some of them will be rapid metabolizers. If you're a pharmacist, could be understanding. Those others are slow metabolizers. So in that case, then, if you give them a lower dose, it will be eliminated before it acts. It will be eliminated before it achieves the therapeutic level because of the breakdown levels. So you need to actually up the dose, increasing the dose. And those are some of the areas that you need to look at is, I've been giving this patient, let's say, for example, metformin for management of their blood sugar levels. However, over 3 months down the line, their blood sugar has not reduced as to what we had expected. That is the review phase. And if that is not the case again, what are the other factors that have been there? What have they been eating? How have they been responding? And if not responding, can we measure the blood sugar levels, the blood levels of this drug in them to assess whether it's meeting the therapeutic level or not? You can partner with labs to do such kind of work. When you're able to do it, you can optimize the amount of drug that you give in that patient. And with that, they can manage their blood sugar levels. And if not working, let's say a single line, you can add additional lines of therapy, but it's based on monitoring to see, are they achieving the positive outcomes? And what are the contributing factors to them not being able to control their sugar levels? If we are considering diabetes in this case, that's another area. Antimicrobial stewardship, we've mentioned the challenges that are happening. People are coming to the pharmacy, they're buying antibiotics, let's say, for example, azithromycin, somebody's coming for amoxicillin, flagyl, along that. Yes, they're consuming them, but do you ever ask them, why are you buying this medicine? And if they can't tell you why, you need to identify what is their medical condition that necessitates use of medicines. Then on that journey, you can be able to help them in rational use of antibiotics and avert the burden of antimicrobial stewardship. That is a pharmaceutical service. When they trust that you're giving them the care that they deserve to stay healthy rather than just selling a product to them, you're making a win. And those are some of the things that we need to look at. There are communities where we talk about neglected tropical diseases. On 30th of January, we were celebrating the World NTDs Awareness Day. When we look at it in the sense that these are neglected tropical diseases, and often we know they are neglected. Therefore, there's limited access to care. Maybe we're working in communities where people are suffering from them, but none of the hospitals actually acknowledges this or might not have already identified this as an issue. So there will be my misdiagnosis. As a pharmacist working in the community, with your technical knowledge as a professional, can you look at what these patterns? Can you monitor them? Can you start an intervention, a community intervention, public health intervention, design a project, collaborate with clinics around or hospitals, the primary healthcare facilities, design solutions like that. You equip them to be able to support and actually diagnose, suspicion, diagnosis, management, then go with the public health teams to promote preventive measures in the community and environmental measures. Those will be advances. So you need to look at what pharmaceutical services do my community need based on their healthcare needs. And therefore, once you identify those, you can intervene and support them in their healthcare journey. Those are just the two key areas that need continuous improvement in community pharmacy practice. And then the next bit in terms of what I'm looking at, how then do we make this happen? We acknowledge that some of the things that happen in terms of our practice, we have quality and even clinical incidents that are not intended. And these quality incidents would be, you sold a drug that is not of the right quality. Maybe it has gotten, it's broken and some part of it, it's been opened at some point. Maybe it got open in the box that you carried it because of poor handling measures in transportation and related. Those are quality incidents. And when you talk about quality incidents, you need to be able to acknowledge that these are possible to happen. It's possible for quality incidents to happen, and you need to take responsibility for them. If a patient comes to your pharmacy and tells you, Well, this is what happened. I bought these medicines, and that is where now they look at quality pharmaceutical products that I mentioned earlier. You can have the quality best practices in terms of prescribing and dispensing. If you dispense drug A and a patient comes back with the same drug A, actually you can trail and confirm it is the same drug that they're coming back with. Good. Now, what is the complaint? The drug that you gave them is not what they had expected, or maybe it has a quality issue. They're used to taking the drug within its white. Now the one you gave them has a yellow half and a white half. It's not what they expected, and therefore they have to report it back to you. When they do report it, once you have your trail in terms of the quality practice that initially mentioned, documenting that evidence. And once you've documented that evidence, you now can do your investigations to assess what happened. Normally, we now within the pharmaceutical distribution practices, there's a recall process, there's a reporting process. Where did you source it? You go to the distributor or the wholesaler. From the wholesaler, they go to the manufacturer. The manufacturer, you report it to them so that they investigate. And as you do that, you also go the regulatory mechanism. The Pharmacy and Poisons Board responsible for regulation. Have you notified them of this quality incident? Is it affecting products in your pharmacy only or affecting other pharmacists as well, so that we ensure we protect the public? Those are quality incidents. How are you managing them? Do you have a method in place? Then the clinical incidents. You're giving a patient some medication, probably they didn't give you much information. And this is one incident that actually I recently addressed with one of my colleagues, when we're looking at it in the sense that a patient came to the pharmacy, didn't give full information about their this physiological condition. And therefore, there was one critical incident, critical component that was not mentioned to the doctor, to the clinician, the pharmacist who was attending to them at the pharmacy. That was a pharmaceutical technician. Then at that particular moment, when that wasn't addressed, one medication, it's not the wrong medication. It's just that based on their physiological condition, it was not preferable. They were breastfeeding, and there's a risk that the medicines could transfer to the patient through suckling, through breastfeeding. So how do we address this? We need to look at, if all that information was given, it would be easier for the pharmacy technician to identify these and also not to give that medication. However, that wasn't the case, and therefore, being that was not shared by the patient, and it was a patient's relative, or I would say a guardian, who shared this information and did not share the whole component of it. So in this case, then, the wrong medication was given, but the goodness is the patient didn't use that medicine. That is a win in the first place. When this patient comes to you back to report that, well, I took this medicine, and when I got home and I realized that this was not the right medicine. The goodness is we are now in a digital era where we can go online and read about medicines as patients. The patient read and realized maybe it has a risk, went back to the pharmacy to consult. It's good when you consult that now, I'll take back the medicine and give you a substitution if you've not had another medication. But rather than just stopping it at that, we need to open a quality incident form. I know this is not something that is practiced by pharmacists or community pharmacies a lot in our different community pharmacy settings, but we need to adopt it as a best practice. Do you have a quality incident form? And when you look at a quality incident form, you need to indicate the date that the incident happened, the date it was reported or discovered by you. So it happened, let's say on Monday, I discovered it on Friday when the patient came back to me. Those are first key things. What is the incident? What did they tell you about it? Document it. Once you've documented what happened, give a description of the impact of it. What are the risk factors? Is it a critical risk, or is it moderate, or is it minor? What is the potential impact of this incident to the health of the patient, or even in your professional practice? If it's a critical one, probably you could even lose your license as a practicing pharmacist or a practicing pharmaceutical technician. It could be critical because it poses the risk to the life of the patient, and they might die, or even the child would die in this case. So what is the criticality? Once you've graded it, now do a root cause investigation. Why did it happen? In this case, the guardian did not share the full information. So what is your corrective action as an individual? Seek further information and now replace their medicine. What is the preventive action? In the long term, you're dealing with patient David today. Tomorrow there will be patient Alex, there will be patient Osborne, there will be patient, all the other patients that will be coming. When they come to you, how do you prevent such incidents ever happening? One, continuously asking for more information, integrating pharmaceutical services that I mentioned. And therefore, you'll be able to put in place, you've identified the investigated, recorded the entry, have a corrective action for the immediate, preventing action for the long term, and then finally, you sign off by acknowledging that this happened, and even if possible, if I were told, for example, there was a litigation action that was in place, or it was reported to the regulator, have the person offended, the patient you are serving, actually acknowledge that they've read the corrective actions, they agree with you, and it is resolved in that manner. If possible, if it went to the regulator, you can have the investigator, the inspector, or the official from the authority also to sign with you to ensure that you've closed that action. If not, within the pharmacy, it might be your pharmacy, let's say it's my pharmacy, and I have somebody working with me. The person who experienced the incident, the technician, let's say, noted that incident. So they have to acknowledge and read, and even the SOPs in terms of what are the best practices. Read and confirm they understand. They sign this form that it's a corrective and preventive action, and we've concluded on that investigation. Then once we conclude on that investigation, you as the owner, because at the end of the day, whether you're working with someone or you're working by yourself, responsibility lies with you. And if responsibility ends with you, you have to document and confirm that you take responsibility for it and ensure you put in the measures. Sign and file it, so that in case any of such incidents has happened, you have a reference mechanism. How did we address it this time? What are the root causes? Is it the same in this case? If it is the same, it means the corrective action or the preventive action didn't work. So what can we do better? So it's a culture of continuous improvement, because we are looking at, these are our shortfalls today. Tomorrow, there might not be our shortfalls, but there can be pointers on how to improve on shortfalls of the next day and the day after tomorrow. And once we can do that, we are making advances and we're improving the quality of care. So that is in managing quality and clinical incident management. And one of the things that I'm working on currently is to design such quality and clinical incident management forms, the quality events. So in case you ever need support in terms of working around those, you can reach out to me and I'll be able to support based on our agreements and how we can do that. Then finally, optimizing your positioning in the community. That is a critical bit, and I'm looking at it in the sense that you work in community pharmacy, you're part of a community, and people trust you and they come to you to seek services. How do you optimize your positioning in that community? You optimize your presence in the community and your positioning in the sense that you want them to trust you. You want them to believe that you are the person they can go to when they need healthcare services. And two, we are currently talking about universal healthcare coverage, actually with the scale out, rollout across the country. It's good, yes, but it might not be feasible through the public health system. And it is your role as a stakeholder within the healthcare space, as a private sector player, to tap into that market and to serve the community the best way possible. How do you do it? By understanding the patient decision journey and the patient or the consumer decision journey. Understanding, initially I mentioned the aspect of integrating pharmaceutical services. What clinical services do the patients in the community need? What determines whether they seek healthcare services or they don't? But those are critical. For example, let's say we have a patient, he is diabetic but not yet diagnosed. So the first thing for us to diagnose a patient to be managed, they have to go for screening and monitoring, medical checkups. So how many of them go to your facility for checkups? Maybe not many, but in that community, you already know from the people you've been managing, there is a high incidence of this diabetes, let's say one of the NCDs. If that is the case, then your action and your responsibility as a critical player in the community is, can you influence their patient decision journeys to ensure they can adopt health checkups, they can seek medical care? Then once you do that, they'll be coming to your clinic for medical checkups, for these general measures and all that, blood pressure, blood sugar levels, the vitals and all that. Once they're doing that, there's a clear case that some of them will be at the extremes, some will be normal. The ones that are normal, they already know, so they can continue with their modest life, the modest, or rather, we could say the optimal living conditions, the better lifestyle that we suggest. The people who might be at critical conditions, you suggest additional assessments, additional diagnostic tests. If that happens, they can be diagnosed at an early stage. And when that happens, it is a win, because they're being diagnosed at an early stage, they're accessing the medication and the healthcare services they needed, which they would not have already started using, which would enable them to regain their health back as it should be. So you need to look at what is influencing their decision journey. And are you helping them, one, to get tested? If diagnosis needs to happen, are you referring them to the diagnostic centers where they can get the diagnosis made? Then once they're diagnosed, what is the care plan? Are you integrating with the facilities around you? Let's say you have labs, you have hospitals. Are you integrating with them to ensure you design an optimal care plan, even with nutritionists, to design the solution that serves the patient and guides them in being the best version of themselves? You don't have to wait for the patient to be very sick that they are being carried to a hospital. You can already influence their decisions by encouraging healthy living, encouraging the medical checkups and all that. So you have to be part of their decision journey and see what are the key pointers, what are the data points, what decides when they seek care and when they don't seek care. On 4th of February, we're celebrating World Cancer Day. When we talk about cancers, everything that we know is it's kind of a death sentence. The people who are diagnosed early, sorry about that. Those who are diagnosed early, they get care, and once they get care, they're able to manage their condition the best way possible. Why? They were diagnosed early, and for them to be diagnosed, they had gone for medical checkups. So how can we influence their ability to go for medical checkups? So that is what will determine whether they seek care or they don't seek care. That is a win for you. So we need to look at it from these dimensions. And once we see those areas on how to tap into those determinants of what patients consume. And you can also link it, let's say, for example, in a business model as a community pharmacy, there are some of the additional nutritional supplements, the general life course products that we use, sanitary towels and all that. You could talk about nutritional supplements and any other product that you're dealing with the community pharmacy. When do patients buy them from you? What are the needs? Can you tap into what are the critical needs, providing you acknowledge that it's not for you to promote irrational use of them, but to help the patient derive maximum optimal benefit out of them and to guide them in that journey, not to delay the ultimate need to use them. And once you win that, you're able to serve your patients better. So key things in adopting a culture of continuous improvement, from quality in the pharmaceutical products and healthcare technologies, they have to be affordable and you have to deliver them following the best practices. Integrate pharmaceutical services into your community pharmacy practice. Then quality and clinical incidents, when they happen, have a robust management system. Could have it as a risk management plan and all that, quality assurance system. We could look into such. Then optimize your positioning in the community by playing an integral role, by being a key player and influencing the patient decision journey and guiding them towards positive and healthy living. Once you win that, you win as a pharmacy, you win for your community, and you're better professional because we are serving the people who need us to serve them better, and you're winning for each and every patient. Thank you so much. I look forward to having you again in the next session. Bye. Have a good evening.